Boogeyman Pots, where two nurses discuss nursing, personal stories, paranormal experiences, and spiritual growth. Booms into the beat, hearts keeping it tight. Diagnosis flowing, rhythms out of sight. Spilling nurse stories in the pale moonlight. Oh yeah. Vitals checking, patient gossip for ya. Stethoscopes rocking like a nurse opera. From the ER to the ward, we got the chatting aura. Laughing and grooving like there's no tomorrow. Oh yeah, deadpans and boogeymen, yeah, we feeling fine. Heartbeat, keeping it in line. From code blues to night hues, we making that climb. Oh baby, tune in, it's podcast time.
Hello, welcome to our brand new podcast, and you'll have to bear with us because we're brand new at this.
Yep.
My name's Sheri, and I've been a registered nurse for over 30 years, but I'm also a healer, and we'll get more into depth on that later. But I'd like to turn it over to my partner and have her introduce herself.
Hi, everyone. My name is Precious. I have been a nurse for 8 years now. I am learning healing from Sheri. I feel like I'm a baby in that. And we have met almost over a year now, I think.
Oh,
right?
Gosh, we've been at least a year and a half.
Yeah.
Because last July is when we went to the Robin Hood Festival. And so
That's right.
So we're over a year of hanging out together and as couples.
Yes.
And so
Yeah, that's right. Because my husband's Corey.
and my husband is Wolf.
Yes.
Anyway, so when we met, Precious came to work where I was working, and
Yes.
I was her preceptor.
Mhm.
And we discovered, even though we have a pretty big age gap, that it's like we're the same person. We have pretty much all the same interests, and including ghost hunting, and paranormal investigation. And so we decided to do this podcast, not only to talk about nursing, because there are a lot of issues like menopause, for example, where
Yes.
we feel like the medical field is failing women.
Absolutely.
And then also things like Hashimoto's, which is not well understood and literally took me over 30 years to get correctly diagnosed. And then I believe, Precious, you have a disorder that also was
Yes.
difficult to deal with. That
Myasthenia gravis. I got that. I got diagnosed when I was in nursing school, and it was really, really tough. And yeah, we could definitely go into that as well. But
and then I'm sure there are a lot of issues that people would just love to have a couple of nurses just talk about, because the doctors don't have time to talk to you. And a lot of times if you get hospitalized with something, the nurses don't have enough time to talk to you about it. And you get left just kind of hanging there with not enough knowledge. Plus, you can get overwhelmed with how much knowledge they try to give you while you're in the hospital or in the doctor's office.
especially if it's like a new diagnosis and you don't know anything about it. And sometimes doctors will talk in doctorese instead of layman's terms, unfortunately.
And then we also want to bring a little bit of humor about, what it's like being a nurse. Why did that patient keep calling the minute somebody walked out of their room every time? Which leads to nurse burnout. And the rationale behind why patients actually do that. So this podcast is also for nurses, because if you can understand where patients are coming from, and I've been hospitalized 7 times, so I know what it's like to be on the other side of the bed. And I was on the other side of the bed before I ever became a nurse, which also leads us into why.
Yeah.
Why did I become a nurse? Why did you become a nurse? So for me, I didn't want to be a nurse when I was a kid. I wanted to be an actor. I wanted to be a musician. I wanted to be a firefighter. I wanted to be a police officer. But being a nurse, wasn't on that list of things I thought I wanted to do until I was pregnant. And I went to this wonderful nurse practitioner at a county clinic. And the way that she took care of me, just, I wanted to be her. She never made me feel like there was another patient waiting in the waiting room, let alone probably 5 or 10 other patients waiting in the waiting room, and just made me feel cared about. And so I wanted to be that person. How about you?
That's crazy, Sheri. As you're saying this to me, I didn't know that. And I feel like, as you said earlier, we're very similar. And our stories on why we became nurses are kind of eerily similar, even down to a county like hospital type thing. The reason why I wanted to become a nurse, which again, I didn't want to be a nurse either when I was growing up. Both of my parents are nurses, and I remember going to school with them when I was very young. And I always thought that was really cool. So I was always like the kid that would help with first aid if my, cousins or my siblings got a scratch or something. But I always wanted to be either a doctor or like an astronaut or something, amazing in the eyes of my parents, right? But when I was pregnant as well with my third child, I remember I had always had the epidural before I had kids. And for anyone who doesn't know, epidural is when you get a shot into your spine, I feel like.
It's in the dura, which is around the spinal cord.
Yes.
It's not directly into the spinal cord. There's a little space there, which means that they have to be very, very careful with that needle when they put it in. I know when I had mine, my mother almost passed out watching them try to put it in.
Yeah, isn't the needle like really big?
Yeah, it's like 6 or 7 inches long.
I'm so glad I didn't see it.
Yeah. But yeah, so it can be scary for the person who's there watching that as well. But yes, it goes into the dura space in between.
Yes, thank you. I just knew like at the time that it had went somewhere into my back, and after that, the pain went away. But I wanted to have an epidural with all of my children, but I ended up getting basically having my contractions come on naturally before I had always had to be what is that word? Induced. I had always had to be induced before, and this time my contractions started to come on naturally, and my doctor had said, hey, like it's time for you to go to the hospital. I'm going to be going on vacation, so we got to get this baby out, right? So I go to the hospital, and it's a county hospital, one that I had never been to before. I'd always been to a different hospital that was wonderful, but I went to this county hospital, and I went there, and the nurse was just awful. So it was completely different than your experience in that way. But I remember she was painful to me. She was not very good bedside manner. She was just like not a good nurse at all. And I remember I kept asking, when can I get the epidural? When can I get the epidural? And they kept saying, oh, you're not ready for it. You're not ready for it. And then I remember feeling much more pressure and a lot more pain. And I couldn't even cry because it was so painful. And then I remember her coming in and I said, can I get that epidural, please? And then she said, oh, sorry, honey, you're past the point that you can get it. So I had to end up having like a natural birth, which I was completely unprepared for. I didn't even know how to breathe right. And so I remember after that experience, I wanted to become a nurse so I would be the best nurse that I could be. So no one in my care would ever feel like the way I felt because of her. So it's kind of crazy that you said that.
Well, interestingly enough, that is still natural childbirth, whether you had an epidural or not.
Yes. Yeah.
Just to clarify.
True.
And also, it doesn't go into the dura; it goes around the dura.
Okay.
Just to clarify.
Yeah. You have to be technical.
Yeah. Well, I am a Virgo,
yes.
So I got to be precise.
Yeah.
And if I don't know something, I'm going to look it up. So that also is going to be really good for those of you who want information from us. But I had that also same thing happen. So I went into premature labor with my second child, and the labor was coming on very fast. Second children, it usually does. But I was 5 weeks too early. And they needed to get a bunch of labs before I could have the epidural.
Yeah.
And by the time they got the lab results back and I could have the epidural, I was already at 9 centimeters.
Oh,
and so technically I was not supposed to get an epidural at that point. They did it, but they had to turn it off like half an hour later so I could push.
And you had already went through almost all of it already.
Yeah.
And did you have like any Lamaze classes or any of that either?
Oh yeah. I mean, yeah, it was my second child. I'd taken Lamaze with my first child.
Okay.
And you know, my babies were never small. So
Exactly.
even though my child was born 5 weeks early, they were 8 pounds, 3.5 ounces.
Oh my God.
And so,
That's a big baby.
yeah.
Wow.
Yeah, after the third one, that was 4 weeks early and 10 pounds, 1.5 ounces, my midwife came to me after I was officially discharged and said, if you ever do this again, it's going to kill you, because I also bleed after I give birth.
That's crazy. 10 pounds?
10 pounds, 4 weeks early.
4 weeks early.
Vaginal birth, not C-section.
Are you okay?
Well, you know, I had a doctor that I went to get my tubes tied after that. And he was a little Asian doctor.
Mm-hmm.
And while he's down there talking about my tubes, he's like, oh, well, you have fibroids. Why don't we just do a hysterectomy? And I'm like, sure. And then he also went, oh, and you could use a little tightening up down there. And so he did that as well. While he was at it, I said, well, why don't you remove the hemorrhoids too? Because, you know, pushing out big babies causes some pretty nasty hemorrhoids. I do not recommend anybody ever have your gynecologist try to remove hemorrhoids.
What? That's a thing?
He did not do it appropriately. He just made them worse. And that was the most painful part of the whole surgery.
Oh my God. That sounds awful.
And so, and he also made things a little too tight.
Okay, I was going to say, he gave you the husband stitch?
He gave me more than the husband stitch.
Oh my goodness.
And so, yeah, there is ways to have, it's called a posterior repair. I'm not going to say the big Latin word for it. For one thing, I can't pronounce it. But yeah, if you've had big children and you're feeling things aren't as good down there, you can have what's called a posterior repair. Okay. And they can help things get tightened up a little bit.
Wow.
But
how long ago was this?
That was in 2000.
Wow.
Yeah.
Was that your last baby?
Yeah, that was my last baby.
Okay, good.
After a 10-pounder, I wasn't about to do it again.
That's insane. I think the biggest baby I ever had, which was my first one, was 9 pounds, 10 ounces. And I was tiny. I was like barely 19. And I remember getting stitched from the bottom to the top.
Yeah.
And that was painful.
You had a stage 4 episiotomy.
Yes. And for those who don't know.
Which causes problems later. So that's where, as the baby comes out, if you haven't been able to do proper stretching, which they recommend you use vitamin E oil or some other kind of like coconut oil, and that you start to stretch the perineum, which is the area the baby's going to come out of, and also where your husband puts or your partner puts their thing. Their penis. Okay. I did say this would be unfiltered, right? If you don't stretch it enough, or if your baby ends up being bigger than anticipated, it can cause some pretty nasty tears down there. And when they have to repair that, it can cause scar tissue that no longer stretches the way it's supposed to.
Yep.
And so it can cause problems later. And again, they can go in and repair that when you're done having children. They're not going to do it before you're done having children, because it's very likely you're going to rip in that spot again the next time you have a child, because there is scar tissue there.
Yep.
So,
and you know, going further into that, I do want to kind of give a shout out to my OBGYN that I had at the time. It's funny because he was actually a guy from China, and he was probably the best OBGYN that I had, because I think I had children like pretty young, and I have 4 kids, and I pretty much had them back to back. And I have read a lot of stories where women have a hard time getting like their tubes tied, or, you know, like hysterectomies or anything like that, because the doctors are always like, well, have you asked your husband if you still want kids? I actually never had that problem with this guy. So I want to say, like, shout out to him, because he was able to tie my tubes after my 4th one. I think I was like 22 years old, too young, but still, like, he didn't give me any questions. He was like, okay, sure, you're good. So
that, ironically, that did you ask your husband question, that still dates back to before women had women's rights.
Yeah.
I mean, you know, they could actually, your husband could put you in a psych ward when you were on your period back
Oh my
back in the
gosh.
1800s.
Yes.
And, up until the 60s when we got women's rights, we were property. And so we couldn't make decisions about our own bodies. And so we've come a long way from there. So kudos to that doctor because he did. But I am finding after you've had your second child, they are more willing to do tubal ligation,
that's good.
tying your tubes.
Yeah.
Hysterectomies, they're not really doing those unless you're later in life or you've had more than enough children.
Yeah.
By somebody's standard. I don't know whose standard that is.
I don't know.
I have 3. Yeah.
Well, and then also, like you said, if like you did have another one, then it would have bodily harmed you, even possible like fatality at the end.
Oh yeah.
So maybe that's why they did it for you. But I don't know because I keep hearing stories like that.
They would have tied my tubes, but to have the full hysterectomy,
that's different.
They only did that because I had a huge fibroid there, which probably is one of the reasons that I was going into premature labor and why my 2 second and third child were actually born early.
Yeah.
Because if the uterus can't stretch any farther because there's a big lump in there that doesn't stretch, then you're not going to be able to go any further. The other potential reason and why my premature babies were so big is back then they were only testing for gestational diabetes, which is when your blood sugar, for those who don't know, when your blood sugar is too high during pregnancy, you get a form of diabetes that is specific to while you're pregnant, and it will usually go away when the pregnancy ends, but you're at a higher risk for developing type 2 diabetes, which is non-insulin dependent diabetes later in life, which we'll go into that in a whole nother podcast because that's we're talking about metabolic syndrome when we get into that.
Yeah.
But anyway, they only tested at 25 weeks. And with both of them, I started premature labor at 28 weeks.
Oh, wow.
And although my second child did not test out with hypoglycemia, which you would find after somebody has had gestational diabetes, is that the baby is born and they become hypoglycemic very quickly. My third child did have hypoglycemia after
birth. Do you
birth.
think you might have had gestational diabetes?
Oh, I probably did because I also lost a lot of weight.
Like during the pregnancy?
During both pregnancies, I lost 16 pounds.
Wow.
Each time.
So were you like really sick the whole time?
Oh, yeah. I couldn't stop vomiting.
Oh, okay.
Through the whole pregnancy.
Did you have that like hyperemesis? I forgot what it's called, but it's like that one that the princess had?
Yeah.
Okay.
Yeah.
Ooh, that's terrible.
But again, I wasn't diagnosed with that. I was diagnosed with gastritis.
Gastritis?
Yeah. So basically the stomach flu.
Wow. For 9 months.
Right. Yeah.
Wow.
So, yeah, it's pretty frustrating to be a nurse in healthcare today because you know that people could actually be helped.
Yep.
And yet it seems like, and I'm probably going to get dinged for this somehow, but it seems like every doctor is in Big Pharma's pocket and all they want to do is placate symptoms rather than actually tell you what's wrong with you and fix it. And not all diseases can be fixed, but a lot of them could.
Yeah, I think so, or at least like symptoms managed. And I know that a lot of medications are there for not the cure, but for the cause, or, like just like you said, kind of just making that money, unfortunately. I know that we're kind of supposedly past like when Big Pharma comes and throws like lunches and gives like gift certificates and things like that to doctors, but I know we're not completely past that. I've definitely seen it.
Well, they still do dinners.
Oh, okay.
But they just can't give all the swag that they used to, and they can't give the free samples like they used to.
Yeah. That
got the doctors to be like, oh yeah, sure, I'll prescribe that. You're going to give me a bunch of free samples. And to be fair, on the doctor's side, it's probably like, oh, you gave me free samples. I can actually give some of this to my patients who can't afford it.
Yeah.
But at the same time, those free samples run out.
Yep, exactly.
And
Like,
then that patient's on a medication that there may have been a medication that could have worked, but now they're on a medication they can't afford.
Yep.
For example, back when Prilosec first came out, it was, I believe it was $8 a capsule.
Oh my gosh.
And they were prescribing it for, I worked in a nursing home at that time, and they were prescribing it for most of those people.
Yeah.
Well, I had a few people who weren't on Medicare. They were on like the VA, or they were private pay. And because it was so expensive, you could actually contact the drug company and get a special disposition, and they would provide it for that patient. But now they like, let's take Victoza, for example. You know, that's a big one that's out there on the market. It's meant for diabetics, but it's now out there being taunted as a weight loss drug.
Yep.
It's over $1,000 for that. Per shot.
Yeah.
Well, for a month's supply.
Oh, okay. And how often are you getting the injections?
That's a daily shot.
Oh my gosh.
Now, they do have Trulicity, which is basically the same drug, but you only have to use it once a week. But again, you're talking like it's $1,200 to $1,500 for a month's supply. The drug company is only giving you $100 off for that. And I know my insurance, because I was on it for a little while because I almost got to the diabetic point. And so I was on it for, I think, 3 years.
Oh, you were on Trulicity?
No, I was on Victoza.
Oh, okay.
And I was still having to pay $200 a month for that medication.
And your insurance covered this?
That was all, my insurance covered all but $300 a month of it.
And this was for diabetes?
Yes.
And this was not for the weight loss. This is for diabetes.
Exactly.
Something that you actually needed it for.
Exactly.
Wow.
And so even the drug company did provide $100, but I still had $200 out of pocket.
That's a lot of money.
That I was having to pay for that. And, you know, for 3 years. And then all of a sudden, because everybody's using it for weight loss, last October, I couldn't even get it because it was out of stock everywhere.
Too many people.
And then when they did get it back in stock, my insurance didn't want to pay for it anymore because it did bring my blood sugars down enough to where I wasn't pre-diabetic. Of course, I'm right back to being pre-diabetic again, almost diabetic, because I have been off these shots for a year, and I gained like 20 pounds almost instantly. And so it's really frustrating to be a nurse in these times when this is what people go through. I mean, diabetic medication itself, insulin, is through the roof. And most elderly people can't afford it hardly at all. So instead of getting Glargine, which is a very long-acting once or twice a day shot, versus taking insulin every meal and at bedtime, and then maybe adding NPH, which is intermediate acting insulin, they end up going on what's called 70-30, which is that part of the, it's got regular and NPH in it. But then they run the risk of, in the middle of their sleep, because they're not going to wake up at home. They don't have a nurse there coming in at 2 a.m. of going hypoglycemic and potentially going into a coma from it. And so it's really sad that medications cost so much. And then with Medicare Part D, which is for your medications, they have this thing called the donut hole.
The donut hole.
And so, I'm looking at these elderly people, like when my mother was alive, she couldn't eat as much as she should have because she had to pay for all these medications. And so what the donut hole is I think I'd have to look it up to be sure, but basically for a certain, I think it's $2,000, the first $2,000 in a year you spend on medications, it's covered 80%, but then $12, the next $1,200 isn't covered at all. And then it starts covering 80% again. Why they decided to do it that way, I don't know, because like somebody who has cancer and needs Epigen to help them produce red blood cells, that's like $4,000 a month. Wait, Was that one the 4,000 or was that the $10,000 one?
It sounds expensive either way.
Yeah. So, we wonder why we have all these homeless people. Well,
some of them are elderly.
Some of them are elderly. Some of them are mentally ill because they closed down Damage State Mental Hospital here in Oregon, and they had nowhere to put all those people. And if they didn't qualify as so disabled that they could, not function at all, then they went on the streets.
Yep.
And so that was the start of it. And that was, I believe, in like 1986.
Was it really?
Mm-hmm.
I mean, talking about that, my example, when I was working on the cardiac floor, is they would put people on the heart medicine Eliquis, and that can be very expensive too.
Eliquis, Pradaxa, all of those, they're so expensive. Any drug, when it comes out, for the first 10 years, they have a patent on. So they can charge however much they want.
Through the roof on that one.
And then after it's out for at least 10 years, then they can have a generic that comes out to match it. But it's.
I remember people would be like, okay, I'm on this new medication that I need to take for basically the rest of my life. How am I going to be able to afford this? And me as a nurse, I'm going in there and saying, well, here's a coupon from the drug company, and then you're just going to have to call your insurance. And I felt like that was so disgusting to me, but I didn't know what else to do.
Yeah.
Yeah,
it's hard. And working in healthcare, it's not an easy task.
No.
I know sometimes it looks like the nurses are just sitting at the nursing station, but the amount of charting we have to do.
Oh my God.
And the concentration we need in order to remember which patient that was that we are charting on and what we assessed. Because like the other day, I didn't get to chart till 3 a.m. I came on at 7 p.m. So for me to keep straight everything I did up until then is really hard. And then to have people come out to the desk and be like, oh, my family member needs water. It's really disrupting.
Yeah.
I can't talk.
No, it's okay. It's distracting and it's just disruptive. And we totally understand. We know that you can't necessarily go and get the water yourself. So obviously you're coming to us and you're asking us for that help. But then also at the same time, that's why we have the call lights. And I know that can be like a whole thing on its own too. But it's just like, hey, that's why we have the call lights. Go ahead and push that button. So that way when we do have a moment, we can go and get that. Because on the other side of it, maybe we aren't necessarily charting. Maybe we're looking something up for a medication to make sure that we're giving something to a patient that needs to be given at a certain time, like an antibiotic or something like that. And in that moment, we need to be able to focus.
Or maybe we just need to sit there and clear our head because it does take a lot. I happen to be an empath. I'm pretty sure Precious is also an empath. And so I literally feel what you're feeling. And not every nurse has that ability, but because I've been working with energy medicine for, 21 years now, I can literally tell a person what their pain feels like. So,
do you want to talk about that?
Well, I do, but let's save that for the next podcast.
Because I think that's amazing.
Because that's a pretty in-depth conversation in itself. I am a pretty gifted person. I've been blessed, but I've also gone through a hell of a lot of trauma in order to get to where I am right now. There go the goosies. And as you know, I've had interactions with spirits almost my whole life, and I tried to shut it down for a long time, but when my mom was passing, it got turned back on full blast. And so there's a lot, but we have a lot that we can put into podcasts. So in the future, we'll definitely be talking about some of my experiences, some of your experiences.
The paranormal part of it all.
I've been with a lot of people as they've passed. I've been able to test their energy field before they leave their body and after. And so being able to talk about that will be good for some people. Ironically, I kind of got into it with somebody yesterday the Facebook afterlife and near-death experiences group, because they were kind of negating people's experiences. And they kept saying that basically that the only afterlife there is heaven or hell, according to the Bible.
Oh.
And so
Same old stuff.
I had to ask them, first of all, which version of the Bible are you reading?
Mm-hmm.
Is it the original? Because the words have been changed in the King James Version.
Yep.
And
The meanings too.
14 books were removed.
Yeah. The Apocrypha? I
Yeah.
think?
Yeah.
Yes.
The Nag Hammadi, I believe, or it's called the Apocrypha. Yeah. I can't say that word either. Anyway, so
Yeah, it's really interesting though.
and the word God was actually Elohim,
Mm-hmm.
and
Or at least that God.
right. Well,
in that Bible.
Elohim means creators or gods,
Oh, okay.
and then everywhere else in the Bible where it says Lord,
Mm-hmm.
they took either the name Jehovah or Yahweh or any other name of God and just said Lord.
Oh, just to kind of like make it easier,
Yes,
I guess, for
yes,
those times too, because
right.
it was like medieval times. I
But
feel like.
the other thing is, if you read the Bible more than once, every time you read it, it's going to read differently to you. The same passage that you may love, you may read it another time and it has a different meaning that time, because it's a living document
Yes.
and it changes to your needs of what you need to hear at the time.
Yeah.
And so in the end, I told him some of my experiences. I have died. I was tasked by Jesus to help lost souls across.
Mm-hmm.
I did not get that memory back until I helped somebody get part of their soul back recently. But that's not my story to tell. So
Yeah, I might have him come on sometime later and talk about it in his own words.
yeah.
But I think that would be good.
And I didn't know I could do that because I didn't even have that memory at that point. But since then, I retrieved that memory, and so I was able to tell this guy on this that, have you died? Did you get to go talk to Jesus?
Mm-hmm.
Because if you haven't, you can't negate what I'm saying based on your interpretation of your Bible.
Yeah, exactly.
And then, eventually he agreed to disagree with me and said, God bless you. And I said, may you live a blessed life. Amen.
Mm-hmm.
Because I may not believe in dogma, but I believe that there is a spiritual being and that we're all here growing our soul.
Yep.
And, that's a whole nother podcast too.
Yes, it is.
Because ironically, the things that I have been telling people for years, I came across Dorothy Cannon.
Oh, yeah.
And she was saying everything that I say. And
Yes.
so
it's validation right there.
right. And so I feel like I have been attached and have access to the Akashic records. Unfortunately, I'm a passive user, so I don't always get somebody can't come up and say, "Oh, can you get this information for me?" and have it happen. But sometimes someone will come and ask me something and I'll be like, "Oh, I don't know." And then like 2 minutes later, I'm like, "But," and I will rattle off what they needed to know. And then I'm like, well, I mean, I could be just BSing you. I don't know. But then if I go and I look it up, it is exactly what they had asked.
I agree. I feel like you've done that to me many times, especially when we were working together and I was still learning, and all of a sudden, like, Sheri would just have the answer. And she would never even know what it was earlier, but she would have it and it would make sense. And then, like you said, we'd look it up and that's what it would be. So it's very like intuitive, I feel like.
Yeah. I'm, it's kind of weird. I just had my 60th birthday.
Mm-hmm.
And I do feel like I'm stepping into my wise woman role.
Mm-hmm.
And I actually met a lady on the plane coming back from San Jose just 2 weeks ago. And we started talking because I was really excited because my daughter is a model and there are 2 statues of her. Mm-hmm. And I got to go visit one of them and I got to get pictures with it. So that was really cool. So, of course, I'm really excited. And even though I'm an introvert, I also can be a very extrovert when I'm excited about things.
Yes.
And so I just opened up and started talking to her. And then she started talking about her joint aches. And I was like, oh, and she's 68. And so I was like, it might not just be arthritis.
Mm-hmm.
And I got to relay what I have been learning about I have arthritis supposedly in every joint, although now my knees no longer have arthritis somehow.
I wonder why.
Yeah. Yeah, I've had some pretty miraculous healing things like the tumor in my bowel that shrunk too, that we'll also get into in another podcast. Because this will run so long if I talked about all of this in one sitting. Mm-hmm. But by the way, I have ADHD.
Yes, so do I.
In case you haven't figured that out, because we've gone through a lot of different topics in a short amount of time here. Yeah. So
if you can follow along, then maybe you might have it too. So welcome aboard.
So anyway, I started talking to her, and then I asked her about if she was on hormone replacement. And of course, doctors with women, it's just like, oh, it's just because you're getting older.
Yep.
It's not. It's totally hormone.
Mm-hmm.
So I found some bioidenticals. We'll talk about that later. And I recommended them to her. And then we started talking about some other things and got on the subject of healing. And she had taken Reiki. And of course, I'm a Reiki master of actually 20 forms of Reiki.
Yeah, that's amazing.
And also a Healing Touch level 5 practitioner, which I kind of forgot about all of the Reiki that I've learned because that was way back in 2003 and or through 2006. And I use Healing Touch way more because it was developed by nurses and certified through the Holistic Nurses Association. And if you want to know more about that, it's healingtouchprogram.org. But started talking to her about that, and she had taken some Reiki classes. And then she told me the most amazing story of how she had been a teacher, and she was driving by a grocery store one day, and she said it was like a laser beam came from the store to her forehead, and she knew there was somebody in the store in a diabetic crisis. And so she stopped and she went in and she helped them. And then the next story she told me, and I may cry when I start talking about this one, was she was at school.
Maybe I'll get some tissues here.
And she looked at her coworker and she knew she wouldn't see her the next day. But she didn't know how to approach that.
That's how super tough.
How to talk to her about it. And the lady died on her way home in the car. She, I believe, probably had a heart attack.
I don't know how you would be able to say something like that to somebody without sounding insane.
Well,
either.
I mean, I had to once.
Really?
Yeah. When I was working at one of the hospitals that I worked at, and I was on loan to IT because of Epic support.
Oh, yeah.
My temporary boss I was back in my little cubby as far away from her in the office as I could get. But I started hearing her talk about going to a meeting and then that she was going to go out drinking afterward. And so now I kind of have to go back a little bit so you understand the next part. But when I was 6 years old, a male voice had told me to leave the house, go out the back door and around to the front of the house. And had I not done that, I would have been shot and killed. The bullet would have gone right to where I was.
Oh my God.
My mother was struggling with her girlfriend who was trying to kill her, and the gun went off, and then her girlfriend killed herself.
Oh my God.
And so I didn't see or hear any of that, but it was a male voice. And so while I was sitting there in the office, the male voice said, she shouldn't drink, she's pregnant.
That same male voice.
That same male voice.
Wow.
And so I'm sitting there going, great, what am I supposed to do with this? But it kept nagging at me. And so I got up and I kind of interjected myself into the conversation, and I didn't really say too much. And the person she was talking to kind of walked off, and so I had her by herself, and I said, so this is going to sound really weird, but is there any chance you're pregnant? And she's like, no. Well, we're getting married in a month and I haven't been on birth control. And I'm like, okay, well, I had this voice that helped me when I was young to not get killed. And it just told me that you should not drink because you're pregnant. And she's like, oh, you're so full of it.
Like, did she take that okay, though? Or was she, like, looking at you weird?
Oh, yeah, I was totally a weirdo. About a week later, she came up and punched me in the arm and said, damn it, Sheri, I'm pregnant. So she didn't look at me as a weirdo anymore after that. But, you know, because it's like, what do you do with that? But I shared that with the lady on the plane.
Mm-hmm.
And I said, you know, we're given these gifts for a reason.
Yeah.
You and I are now in our wise woman phase. So embrace it. Because she turned everything off after that. That hurt her so bad that she turned it off. And for people, when I was younger, for me to talk about the spirits that I was interacting with and things.
Mm-hmm.
And, you know, I became the picked on kid. I was the weirdo. And so I shut it down too for a long time with her that, you know, we have these gifts for a reason and we shouldn't be afraid to use them. You know,
that's the hard part though. Like it's super scary.
It is, especially if it's a stranger and you're getting this message that they need help. And how do you approach that person?
How do you tell someone they're going to die? Like that.
Actually, in that case, it would have been, I really think you should go to the doctor right now. And, you know, we all have guides with us at all the time. We have a guide that is our guardian angel that protects us. We have a guide that is our joy. We have, and whatever we choose to do in life, we have a guide that comes into our energy field and helps us with that. And so perhaps asking that guide to help guide you in how you can get them to listen. Or, you know, sometimes like recently, my ex-father-in-law contacted me as a spirit, and he said his daughter's name, my ex-sister-in-law, and I asked the clarifying question of, do you mean Dee Dee? And it said yes. And then I said, okay. And I actually thought it was Dee Dee, that something had happened to her and she was coming to talk to me. But then it said help and then relative. And so I pondered on that. I was just getting ready for bed and I didn't know what to do with that. And so when I woke up, I felt compelled to check on Dee Dee. Even though I hadn't talked to her in a couple of years.
Yeah.
And so I went ahead and I sent her a Facebook message saying, hey, I had a dream about you. And I was wondering if you're okay. And she came back and the first thing she said is, yeah, but I'm so stressed out. I feel like I could die. And so it turns out that my ex-husband lives with his mother. And their mother is 84 and is thinking about moving into an independent living and needs to sell her house. And he's not helping. Well, because he's dragging his feet because he doesn't want her to sell the house because he thinks he should inherit it. So they now, they moved to the coast, but they had lived here. And so the daughter got to buy the house here. And so he's dragging his feet. And Debbie's having to go all the way from Portland to the coast after working 5 days a week to help get this house ready to sell.
And the son is not helping.
Right.
Your ex.
Right.
Yeah.
But the way I could help Debbie was in telling her as a nurse, hey, well, is your mom getting to the point she can't do things for herself? And no, she just got her driver's license renewed. She can still shop. She can still clean. She can still... Okay, well, then what I would recommend is moving her into a ground floor apartment in an area near you where you and your kids can visit her more.
Yes.
Because if she goes into an independent living, her money's going to be gone in no time because they're a minimum of $5,000 a month.
It's so expensive.
And when my mother had breast cancer and went into one, they didn't even do anything for her. And my mother had religious dietary restrictions, but that's the kind of food they always served. So she ended up as a diabetic getting peanut butter and jelly sandwiches a lot and getting charged an extra $5 because it was not what they were serving.
That's insane.
And so I highly recommend, if your parent needs care, really, really research. And it might be even cheaper to get a part-time caregiver to come in and do housekeeping and whatnot in their own place, rather than
thousands of dollars
moving into an assisted living or independent living even. And then my aunt, she just moved back into an independent living because she's 91 and she has been falling.
Oh, wow.
And they made her pay the partial month's rent to move in, but also an additional $5,500 for general upkeep of the building. I mean, isn't that where their $5,000 a month goes, is to upkeep the building?
That's insane.
And apparently every resident there was charged that additional $5,500. Well, I mean, I know it's more of an upper class assisted or independent living place, but
that's a lot of money.
That's a lot of money to help them upkeep their building when they're already charging them $5,000 a month. So anyway.
Yeah.
So I was able to help Debbie in that manner of that education piece. But then I actually did reach out to my ex-husband, and I talked to, I said, also while I was talking to Debbie, I ended up calling her on the phone and telling her it was actually a message that I'd received from her father, because I didn't know it was her father until I actually started talking to her.
Oh, how did you find that out?
For one thing, the Ghost Tube app said my name and spelled it correctly. That's the first time in 3 years it's ever done that.
Yeah.
The fact that he died a year after my mother, so I knew he was gone. And then just the way that the conversation went with Debbie, it dawned on me all of a sudden, and I got goosebumps all over that it was her dad.
You felt like it was her dad, like that came to you.
Yeah.
Okay.
And he always liked me, but the mother never did. And so, it just made sense. And like, as soon as I got her on the phone and told her it was actually a message from her dad, and how I've started getting these messages and things, I just started bawling when I was talking to her, because it felt true.
Yeah. And how did she react to that?
Oh, she of course got teary too, because
it's her dad.
But she said that absolutely sounds like something my dad would do, is to reach out to you, because I am probably the one person my ex-husband will still listen to.
Wow.
But anyway, so I reached out to him via text. I said, hey, I got a message from your dad for you. And he responded and he said, oh, really? What's the message? And I said, you need to help your sister. It's really important that you help your sister. She's getting very stressed out. And he says, well, I don't want my mom to sell the house. And I'm like, well, regardless of what you want, she needs to, because even if you don't sell the house right now, when she does need to get in and have care and has to go on Medicaid, they're going to take the house anyway.
Yep, exactly.
They're going to put a lien on it, and they're going to possibly make you sell it.
Yep.
And so,
and then take that money and be gone with
it's
it.
better that your mom gets to use the money the way she wants to use the money now. And so he did say, I guess I'm going to have to find somewhere to live, and I don't know what I'm going to do because I only work part-time. And so, I mean, it wasn't great news for him, but he also understood that that kind of message would come from his dad. And so anyway, we kind of went around off topic, but I was sharing with this lady on the airplane about, my experiences and how we're in our wise woman phase, and it's time to step into the gifts that God is, or universe, or however you want to say, whatever you feel. Because my own personal belief is we're all the same energy out here experiencing itself. And each one of us has our own part to play in that. But I was talking about that. And then she started talking about, she had gone to this place in Hillsborough that had a gigantic singing bowl.
That's cool.
And she stood inside of it. And when they gonged it, she felt like her whole energy system just lit up. And
Wait, she stood inside of it?
yes.
Wow, that's cool.
And she just felt like it lit her entire energy system up, and she just felt alive and like she was on fire in a good way.
Like kind of like awakened.
Yes.
Huh.
And her son also has some psychic abilities, but she has this innate fear because her husband's a non-believer.
Yeah.
And I'm like, well, you know, it does run in families, and you have to own your own stuff, and he has to own his own stuff.
Yeah, exactly.
But then she was telling me about a friend she has who also stepped into that bowl, but the energy stopped at the solar plexus. And that this friend has been a friend since high school, and she's gone through a lot of trauma. And I told her that we could get together and I could use her as a proxy to do some energy work on her friend if they wanted that. And because her friend lives in Colorado. So then as we're leaving the plane, we're talking, and she looks back at me and goes, you know, some of the things that you said really made me start thinking, you're right. I'm in my wise woman phase.
Good.
I need to step up and use the gifts I've been given.
Mm-hmm.
And so that was a really cool feeling. And I met a new friend.
No, that's awesome. I mean, I know I'm not quite there yet.
Well, you're where I was at your age.
Yeah.
You
and
are
I feel like
exactly at the same point spiritually and psychically. Actually, you're higher psychically than I was at your age, because I still had everything shut off at that point.
Well, and I think for a long time I also did too, because I don't know if we came from similar backgrounds in that basically, like, I was raised Christian, you know, like in the church, fundamentalist Christian, supposedly non-denominational. But I remember saying that I could see things, I could feel things, and especially my dad would be like, oh no, that's the devil, or oh no, that's just like you know, playing games. I remember even saying at one point, Dad, I feel like I can fly. And I think I was like 4 or 5 years old, you know, like both me and my sister would say that. And it was always, oh no, you just saw that on the TV. And so to say those things out loud was to be met with like that criticism, and like to be an other, as you said, like I was the oldest daughter, so you always had to be perfect. And
I was the youngest. Well, until my mother adopted another daughter, but she's like literally the same age as my children. So
yeah, and so it just, I mean, I just felt like I had to not say the things that were coming through to me, and I think I also turned it off for a long time. Although I did experience certain things, but it was always like, no, that's bad, or no, you can't do that, or, you know, like that's the devil, or that's demons, or, you know, what have you. And I'm not saying there's not bad in the world, you know, opposed to good. But at the same time, I have come to realize that, yes, we have been given these gifts by who I don't know yet. I'm still learning, and I'm still trying to refine. But again, I feel like I am coming at this like very novice level, if you go into like, you know, the novice to the expert. And I don't know where you are yet, Sheri. I know that everyone's learning still, but I feel like you're definitely way higher than me. I mean, obviously you went through a lot of things to get there, and it's just amazing to me to see you being able to kind of expand and grow on your journey too, which is cool.
I know you've watched me, if we were playing a game, level up about 3 times since just in the last year and a half.
Exactly.
And I think a lot of that is just getting that validation that I'm not crazy, because people make you feel crazy when you have psychic abilities.
Yes.
I mean, not only am I clairaudient, but I have had the smells, I've had the tastes, I've had visions. So I basically, all of the clairs have come on. I definitely am claircognizant and clairsentient.
Yeah.
And so I don't remember the name for the clair, it's Gusta or something, and the one for smell.
Oh, yeah.
I have to look those up. But I don't talk about that to everyone, though, because most people just look at me like I'm a kook. Yeah. But nowadays I'm just saying I'm weird, and I know it, and that's okay, because I'm supposed to be. I'm supposed to be here. I'm a helper. I am here to help people. I'm here to help people heal. I'm here apparently to help spirits across. And I have helped a few spirits across, and I'm just, eventually going to have that healing retreat center where we have classes and we're able to do healing sessions and teach people how to do the things that we will know how to do.
And I think that we were talking about this before, like off air, but I feel like a lot of people are waking up, and you'll see a lot of like YouTube videos and just people talking about it. And I feel like that is true. Like more and more people are kind of waking up to the notion that there is something else out there, and not necessarily it has to be black and white like a lot of religious sects, will tell you. But I feel like there's so many different things out there that we're still learning, and kind of like, I watch a lot of movies, so I kind of relate to a lot of, those types of things. And one of the Marvel movies, Thor's using, thunder and magic, but really it's not magic to them. It's just science. And we're not there yet, So that's how I feel. Like we're seeing the magic happen, but eventually we will see the science behind it.
Well, I mean, there is science behind energy work. Our bodies are energy. We have chakras and we have meridians. And when things happen to us, they get blocked. Mm-hmm. And that's what starts with dis-ease, because we have an uneasiness about us because something has caused it. Either it's physical, it's mental, it's emotional. It could be astral, because people can attack you on the astral plane. It could even be karmic from, you came here. I know a lot of people don't believe in reincarnation, but there is such a thing as ancestral karmic debt, where your bloodline actually, somewhere back there had some issues and it hasn't been cleared yet. And so anytime any of those happen, we start with dis-ease and we'll start to get some symptoms. If we don't pay attention to those symptoms, let's see, what's a really good example? Liver.
Yes.
You start to have some liver inflammation, your cholesterol starts to go up. The liver is all anger turned inward.
Oh,
so if you're angry about something that you've had happen or let happen in your life that you felt like you could have had better control, but you didn't, trust me, you didn't have control.
Yeah.
And it was something that you needed to go through to get a lesson. But that anger, if you don't deal with that, it will become disease, either non-fatty liver disorder. You'll start you could develop hepatitis A. You could run into somebody who has hepatitis B or C without knowing it and get infected with that. That's when it gets really bad. You could start drinking. You could, end up with alcohol cirrhosis, all those things. So it doesn't even have to be related to drug use or alcohol use. It could just be that anger turned inward causes disease in the body. And you're going to get little symptoms, but if you don't pay attention, it becomes an actual disease. And the longer that you don't pay attention to it, the worse that disease gets, and then becomes, after 6 months, it becomes chronic.
Yep.
And then it's really hard to deal with.
Yep.
So for example, my thyroid, I know exactly why it went out, and why it still isn't totally back into whack. But again, that's another podcast, because that's a pretty extensive story in itself.
Yeah, talking about like the emotional side of it and the spiritual side, kind of going along with the physical side. I mean, we know it, we see it, we just don't have the science to kind of link it yet. But I know that it like you said,
there's so many books on body-mind connection now, and even OHSU has a program. It's a research program and it's about psychoneuroimmunology. And that is exactly what the body-mind connection is. And what it does is they are testing how different stressors cause diseases. And again, it has to do with what's going on in your head because everything gets processed through your mind. And if you've had a trauma, like you've been abused. And if that isn't dealt with, it's going to end up giving you things like ADHD.
Yep.
And like when I grew up, going to a mental health provider, that was off the table.
Yeah.
Even when I attempted suicide, I wasn't taken to a doctor or a hospital. I was taken and left on grandparents' couch.
Wow.
And so,
wow. How long ago was that? Like,
I was 14 when that happened. And
wow.
my aunt, who I was living with, she's not really my aunt, but she's been my aunt forever. So, she worked at Damage State Mental Institute.
Oh, okay.
And she came and she picked me up and took me over to her parents' house and put me on their couch.
Mm.
Now, mind you, I'd taken a whole lot of muscle relaxers with some alcohol. And she didn't even take me to a hospital.
And she was a person, was she a nurse as well?
No, she was a med aide.
Oh, okay. But still, she kind of saw what was happening in that world.
But back then, you just didn't go to mental health providers.
Yeah.
And so, I had a lot of traumas happen to me that, like when I was bit clear through both my legs by her dog when I was 5, I was told it was my fault because I got too close to the blind Doberman's dish while we were camping. And that's how we were raised. And so there's a lot of blockages that happen from that kind of stuff. And a lot of guilt, like, oh my gosh, it's my fault that the dog almost crippled both my legs.
Oh my gosh.
Literally a quarter inch from me being unable to walk for the rest of my life.
Wow.
And so, you get, everybody has traumas.
Yes.
And so they get their energy system backed up and they can't process, and they, might start getting small symptoms, but they are told to ignore it, or they can't afford to go to the doctor, so they don't, and then it becomes disease.
Yes. I've heard about, there's like some sort of exercise, or like, I don't know what it's called, but it's like where you store the trauma in your body. And there's some sort of like an exercise that you can do to try to release some of that. Have you heard of that before?
There's lots of different ways you can release it. There's breath work. What I would recommend for somebody is you don't have to come to me for a healing session. There is a self-chakra connection that you can do, that anybody can do on themselves. And I believe that one, if you read Joy's Way by Dr. Joy, he has some really good healing techniques in his book. And then, of course, Hands of Light by Barbara Brennan.
Oh, yeah.
Is, if you want to know anything about energy fields, she's an astrophysicist and she can see auras, and she has a wonderful book. In fact, I think she's got 3 books out now. The second one was Emerging Light, and I don't know the name of the third one yet, but.
Oh, yeah, I think I have one here.
Yeah, you have. Yeah. I can see light emerging.
Yeah.
I got it backwards. I said emerging light. It's light emerging.
Yes.
But wonderful information. In fact, I did the Haroline meditation for you once out of her book.
Oh, really? What was that one?
That's the one where I took you all the way into the stars and the cosmos, and then all the way back down to anchor into the molten lava.
Mm-hmm.
Yeah.
Yeah. I need to do those a little bit more because I feel like I'm kind of lacking on the grounding, but we can talk about that another time too. Just like a lot of things to learn, know, but it's good.
If you're not learning, you're stagnant and you're probably not going to reach your life goals.
Mm-hmm. Exactly.
And so, in fact, you were talking about YouTube videos and stuff and how people are awakening.
Yeah.
With all of this rapid growth I've been having, it's really amazing when I go to YouTube and a reading is there and it's talking exactly about what I'm going through. And this is a way that spirit talks to people.
Mm-hmm.
If you're paying attention, you can get messages through the television. You can get messages through the music you're hearing. A certain song will play when you hit a certain point every single time because it's trying to give you a message. And a lot of people don't pay attention to those messages. But when you do, you find that Spirit's there to guide you because Spirit, bless you.
Sorry.
Spirit wants you to have a good life. there are lessons you have to learn.
Yeah.
And you don't become who you're supposed to be without going through some of these hard things.
Yep.
But if you can make it through those and you get to a certain point in your life, the hard things kind of stop once you realize what your true purpose is, and things start to go a lot better. And kind of, I don't want to jinx anybody, but it almost feels too easy sometimes.
I want it to feel too easy. I'm not there just yet, but some of the things that I've been noticing recently is numbers.
Oh yeah.
I've been seeing a lot of like 111s, 333s. And I feel like when I see the 111, I feel like, okay, I'm supposed to be here right now.
Mm-hmm.
Like this is my path.
Those are called angel numbers.
Mm-hmm.
And there are also master numbers, 11, 22, 33. Those are very prominent numbers, especially if they come up in readings. And numbers are pretty interesting to pay attention to. There are a lot of resources online that people can look up if they're always like, I have taken to screenshotting when I just happen to look up and it's on a triple digit.
Yep.
And I get 444, 222, 555 quite a bit.
Okay.
And so, yeah, it's kind of weird. It started happening so much. I just, every time I and it can't be like you're looking at a clock and you know it's going to turn in a couple minutes, so you pay attention. It has to be a random thing where you just happen to look up and the clock or some other thing is showing you these numbers. It's definitely can't be a forced thing, but I just got to where I started screenshotting it every time, because those again are messages to help you either let you know you're on the right path, or hey, you might need to back up off that path and take a different leg. So
yeah, that's exactly what I'm saying is like, I feel like recently I've been seeing that 111 so much where I'm just like looking up and I see it, or I'm, looking at my computer all of a sudden and it's like, boom, right there. Or I'm in my car and I'm driving and I look up to see like something on my like radio area and it's 111. And so I feel like, to me, that makes me feel like I am on the right path, which is nice,
The meaning of angel number 111 is trust your intuition, have faith in the journey ahead, and you're on the right path and the universe is supporting you.
Yeah, exactly. And I feel like I've been seeing that a lot, especially within the last few months. And I feel like a big part of it is, it's hard right now. My life is hard. It could be worse, obviously, but I feel like when I see that, it kind of helps reinforce that I am doing the right thing, that I am making the right decisions, because I still feel like I'm blocked, but I know we can talk about that another time too. And I feel like if I see something like that, it's giving me like that validation where my spirit guide or my spirit or whatever you want to say is kind of saying, yeah, you're doing good.
Yeah.
Keep it up, So I appreciate that. In like just small ways like that too.
And just remember, just like atoms, and you have your periods of wave and your periods of
stagnancy.
Yeah. It's looking at a particle. A particle doesn't exist until you look at it, and it's either in a wave or, and I can't remember what the other position of it is.
Okay, yeah. That's what quantum physics.
Yes.
Right? Yeah. I'm trying to think about that too. I don't know. But I do know that I have definitely been able to slowly level up a little bit of my abilities. I feel like I'm very impatient and I need to be patient. I know that you've said that to me many times. And I feel like I just want it to be now. And I always have to stop myself. But it's slowly but surely.
So you're either in the wave or you are the particle.
Oh, okay.
And so, yeah. So everybody's life has its up points, and then it's going to go through a period of a down point, because that's what builds your resilience. If you never have to experience anything bad in your life, you would not grow, because growth only happens when you're out of your comfort zone. And if
Yeah.
everything is good and easy, then you don't grow.
Yes.
And so
I feel like I'm meant to grow a lot.
it's a really, really hard thing for people to get because, we look at billionaires who seem to just have it great.
Mm-hmm.
I bet if you walk a day in their shoes, it's probably not so great because
Yeah.
they probably have a lot of background things that they have to manage all the time. And they probably don't get a lot of sleep. And they're probably not very happy in reality.
I agree.
And so if we don't have those periods of good to help us recover, then it's really hard to deal with those lows.
Mm-hmm.
And that's where we lose a lot of people.
Yeah.
Especially if their high point of the wave isn't very high and then they go right back into a low point. But part of that is them not doing their inner work in order to grow and to become who they're supposed to be, who they wanted to, what lessons they wanted to learn this time around. And so, I
agree.
Being in the wave isn't fun. Being in the particle stage is great.
Yeah.
But, again, if nobody's watching, you're a wave. And so that also speaks to intent. We're so lost. So many people are so lost in their phones.
Yeah, that's true.
And
especially my generation and younger, like
the
Gen Z, millennials. I feel like everyone nowadays, to be honest.
mean, even I just had a reading the other day that basically told me I've been hiding in this phone. I've been avoiding what I'm supposed to be doing. And what I'm supposed to be doing is letting people know why they're here and that life can be better. In fact, be careful what you focus on, because that old adage, be careful what you wish for. The universe doesn't know the difference between a fear and a desire. And so if you're afraid that you're not going to have enough money for rent, guess what's going to happen? You're not going to have enough money for rent. If you are like, okay, I know that the universe is going to provide. Now, this doesn't mean you can quit your job. You got to be real. You still have to do the mundane things. But if you're focusing on positive things, you're going to attract positive things.
Yeah.
If you're focused on negative things, you're going to attract negative things.
I definitely
It's the law of attraction. And so my favorite adage on this is, it's like giving somebody blood. If you have positive blood, you can take Rh negative blood. But if you have Rh negative blood, you cannot take a positive. So if you're in that negative state of being all the time, there's nothing positive that's going to come your way. But if you can live a life where you're grateful, be grateful that you have food to eat. Be grateful you have shoes on your feet. Be grateful that you have people who care about you. Or whatever it is you can find that makes you have gratitude, the more you live in that state of gratitude and being thankful and having that positive attitude, the more you're going to draw that positivity to you. We just had this conversation with someone not too long ago, and they started practicing what I was talking about, and they ended up getting a job that paid twice as much.
Oh, that's nice.
And so, and it happens pretty quickly when you start doing it.
Yeah.
But you really have to feel it in your heart. You can't just think. You have to feel it. And I know there's lots of books out there, like The Secret, which was from Wallace Wattles.
Oh, really?
Yeah. Almost.
Well, they got to make money somehow, I guess.
There are things missing in that direction. It's not great to actually do a vision board the way she talks about, because then you're constantly focusing on what you want. It's better to get an image in your head of a basic thing you want and let it go.
Like put it onto the universe?
Just let it go and know that it's going to happen in the universe's time. And when you're really truly ready for it.
Yeah.
It's just going to happen. And you can't be real super specific on what you want. Like you can't say, I want a Lamborghini Countach in blue with leather seats and a 12 cylinder engine, and I want it tomorrow. That's not probably going to happen for you, but you can say, I would like a decent car that's going to be safe, that's not going to break down. The universe will figure out how to get it for you. I'm not saying you're not going to have to earn some money to help pay for it.
Yes.
But some big deal is going to come along. An example of that would be my brother. He got a truck that he really just didn't like. They didn't know that the guy who had an accident in it had done the work himself, and he didn't do it correctly. So like the headlight fell out of it twice, and he was really mad about it. And then all of a sudden his psychic abilities turned back on.
Okay, you're gonna have to talk to me about that later.
I almost wonder if because I'm going up vibrationally, if it didn't help him as well. But anyway, he was really angry at first, and he was like sending letters to the dealership about how he was going to come out there and he's a disabled vet and he's going to stand out there with a sign saying how they took advantage of him. And he changed his attitude when his psychic abilities came back on, and he was shown why certain things had happened the way that they happened in a meditation. And then he approached it differently, and he went into the dealership and he said, I'm just really afraid that this vehicle is going to break down on me. And it scares me, and I am dealing with a lot of things that are going on in my own psyche. And, I'm sorry that I came off as this, angry jerk, but I just, I really want to feel safe. And he ended up getting a $74,000 truck for $50,000.
Wow. So they knocked off like 24,000.
Yeah.
That's pretty good. Like, that's really good.
Yeah. And so he may not have gotten a truck for free, but he got a beautiful truck that he loves. Pretty cool truck, actually. And it was because his whole persona changed. So what was going on when he bought the other truck? He was angry at his boss. He had quit his job and retired because of all the anger. And he was in this negative space.
Oh my God.
So this is very wrong, negative thinking, right?
Yeah, like extremely.
And so, he got a truck. He got a POS truck.
Yeah.
That was like literally breaking down on him, and it wasn't that old of a truck. And then when he changed and he was shown why this boss was acting the way he was shown that it was his own behavior that was scaring this man and causing him to be a little aggressive towards him. And once he saw that, and he's like, oh, so it really wasn't that guy's fault. It was really actually my behavior and my fault. And that's a whole nother lesson for people, that you do have to take responsibility for the things that you do in your life and what happens as a result of that. And sometimes what happens as a result of those things are negative things that happen to us. And if you can resolve those within yourself, even if you can't talk to somebody that you feel like you've harmed, if you do like an unsent letter, you write it all down. Yep. And you can either burn it or you can mail it to nowhere.
Yeah, that's true.
It will take it off of your soul.
Have you heard of those like burn after reading or writing, like little notebooks?
I actually have a few different books on different types of journaling, including the write it and get rid of it.
Yeah. I feel like those are helpful.
It's a really good technique, especially if you have trouble letting go of things. And then when it is hard for us as humans to be able to let things go, especially if we feel like it's somebody else's fault. If we can step into the other person's shoes and try to see it from their side, well, if everybody could do that, we probably would have peace in the world.
Yes, I agree.
Because a lot of times, especially with our patients, and I started the podcast at the very beginning with this, when they're on the call bell and you leave the room and they're on the call bell again. So what's really going on there?
Mm-hmm.
They're in an unfamiliar environment. They've just had surgery. They may or may not have had everything explained well, especially with this new trend of not giving people narcotics for pain even after surgery.
Yeah, that's insane to me.
And sometimes they just need a little understanding and a little bit of your time, which I know that a lot of nurses are still in that task space. I got to get these things done.
Mm-hmm.
But honestly, if you take the time to take a breath and count to 10, you're going to expand time.
Yep.
And you're going to be able to actually help that person in that room. And then they're not going to call you as often.
And you'll be able to put yourself into their shoes too. Because it doesn't take somebody to become a patient to be able to understand the patient if you take the time to be able to do that. And a lot of us don't have that time, unfortunately.
Yeah.
You know?
Well, and the patient doesn't know why they're needing you all the time. They're there and there's a call bell and
they told me to hit it
and,
if I needed something.
You know, and they don't understand that they're not the only person you're taking care of.
Yeah.
And so just spending that 5 or 10 minutes with them and really showing them that you care is so important.
That can be the difference between a good shift and a bad shift.
Oh, yeah.
To be honest.
Yeah.
Just explaining things to people. And of course, as nurses, we explain everything. The doctor comes in, does their thing, and then who answers the questions? The nurses. So.
Yes, but then there's anesthesia, which gives you amnesia. And so even though you've explained it, or the nurse before you's explained it, you may have to explain it a couple more times in that first 24 hours because they don't always remember.
Mm-hmm.
Yeah, which is why we don't want you driving after you've had a procedure and why you have to have somebody responsible with you, because that's another real frustration is when patients come in for procedures and they think they can drive themselves, even when they've been told they can't.
You know, I want to kind of go back to like what you were talking about, like the law of attraction and things like that. There are two things that I heard recently or I saw online somewhere, and I want to kind of get your opinion on it. So one of them is like this little, I don't know, it was like a little meme or something that it said, romanticize your life. Like, what's somebody going to do about it? Like, fall in love with your life, live the life that you want to, right? And then the other one was this girl who was saying how she kind of sees her life and how she feels like she succeeds. She looks ahead to the future of what she wants to be, right? Like whether that's CEO or whatever, or I want to have a nice car. And she just says that she, instead of like looking at that person, she feels like I am that person now.
Yeah, that's a really good technique, actually.
And I heard that and I thought that was like mind blowing because I didn't even think about that. You know, like I am that person in the future now. And so I'm going to continue being that person.
So you and I have talked before about multiverse.
Mm-hmm. I'm
a very firm believer that the multiverse exists, and there'll be a podcast on that because I've had some experiences that I'm pretty sure I switched universes.
Yeah.
But there are a lot of meditations, especially on YouTube, that help you to do just that, to jump from one universe to another. And so my feeling is that each time we have a major decision in our life, both things happen. The choice you made in this universe, we go down that path, but it splits into another universe there, and the other decision is also taken.
Yeah.
So, for example, when I married my first husband, another me never married him.
Yeah, exactly.
And so I do believe I have experienced switching universes a couple of times now. And so that process of imagining you as what you want to be is basically you're going to the universe that actually is doing that. And so...
And then you're kind of like taking that like information or that persona and applying it to your life, I guess.
Right.
I can see that.
Yeah.
And I know it's hard to do that. Like you have to intentionally do that. So
I mean, Michael Talbot wrote a book called Holographic Universe. And I read it, and it's a great theory, but I have no idea how to implement that, because in that book, he talks about how instantaneously you could make something appear before you because it's a holographic universe that we live in.
I mean, that would be badass.
It would. I really wish I could have, developed the technique for that, because that would be really cool.
That
to
would be
just
magic right there.
I mean, honestly, if I had a superpower, it would be, I want 2 superpowers to instantly heal people of all of their diseases and problems.
Yes.
The other is to fly.
Yes.
I miss the dreams of flying, man. I used to love those.
Yeah, those are fun.
Yeah. I'm sure in some universe we can.
Oh, absolutely.
'Cause
I mean, like I said, like when I was young, I remember doing that. And it just, as I'm older, I think like, oh, there's no way, reality. But when you're young, I don't know. You don't know. And we were by ourselves. Who knows who we were with, you know? We were like being floated along somehow or somewhere. So I think that's really cool.
Yeah.
But yeah, so I think that, what do you think? That was pretty good.
Yeah,
beginning?
I think that was a really, really long and a little bit chaotic. So hopefully, we'll narrow it down. I think as an intro, you kind of can get a feel for all the different things that we'll be talking about on this podcast. One thing we'll definitely talk about one time is things people put in their butts in the ER.
Yes.
And why.
Yeah, why? Why?
And why do you...
Come on now.
Why do you lie about it? I mean, it's pretty obvious. So, yeah. In the future, it looks like we're going to be talking about more of each of our traumas that we've gone through, different disease processes, and the fact, some of the things that you'll never learn from a doctor or even a lot of nurses, how you can heal your own energy field.
Yes. Just like the learning of it too.
Yeah.
The steps, step by steps on what we're learning and how we're growing as well.
Yeah.
So.
And various ghost hunting stories, since we're also paranormal investigators.
Because we have not even gotten into those yet, and that's fun.
Right.
All right, everyone. Thanks so much for listening.
And I don't know which forum we're going to put this on, but please like and hopefully subscribe, and we'll get better at this as we go.
We'll see you next time.
Until then, take care.
Creeping down the hall with our flashlights gleam. Hear that IV drip, it's a spooky theme. Whispers of the night like a doctor's dream. Grooving with the ghosts, if you know what I mean. Oh yeah. Shift's almost over, but we ain't slowing. Tales of the ward forever growing. Pump up that beat, keep the stories flowing. From scars to scares, we keep glowing. Ooh.